2 years into the pandemic, we now have access to some different COVID treatments like infusions and pills. Federal and state leaders are trying to increase capacity and let people know this is really available. Providers see it as a game changer, especially for those who are at high risk. Here's 9 News reporter Jennifer Meckles.
So these are monoclonal antibodies.
Inside this small little fridge sits another tool for COVID-19.
We're using the bebtelovimab only for the current circulating subvariant of Omicron.
While a vaccine offers prevention, Leah Jones is holding a treatment.
Some people are still not aware that this is out there.
She's a nurse practitioner with Rely Primary Care in Aurora, and her team brings treatment straight to an eligible patient's home.
We're trying to keep them in their home and reduce the spread of the virus as much as possible. Also, sometimes people aren't feeling well enough to leave their home.
Therapeutics like antibody infusions or pills like Paxlovid are meant for higher risk patients and available through many different providers across Colorado. Some are even now part of the federal Test to Treat program, meaning a patient can get a COVID test, get a prescription, and get it filled all in one visit.
So the idea is that it's a one-stop shop for that evaluation, for the testing with a quick result, and then a quick delivery of the medication.
National Jewish Health offers this too. Chief Medical Officer Dr. Carrie Horn explains who exactly this is meant to help.
Now is that, a large portion of the population is vaccinated, so their risk of severe disease and hospitalization is much lower. And then you still have this at-risk population that, even with the vaccine, could still get severely ill. That's where you want to target this treatment. So again, if you treat them early as an outpatient, their chance of ending up in the hospital is lower.
There's a list on our website of all of the places that provide therapeutics, on the state website, plus the ones that are involved in this Test to Treat program. In that program, the drugs themselves are free, but the provider said you will likely have some kind of a charge for the services side, like if you're meeting with a provider, but insurance will often cover that, Kim.
And it really, time matters, right? The sooner you know, get in.
Yes, these providers tell us this is not something you do like a week later. It's something in the first few days of showing symptoms for COVID-19.
Game changer. All right. Thank you, Jenny.